Right there on your bathroom shelf, pa, or maybe in your purse, paf, there is something I need you to look at differently. It's probably a medication you've been taking for years, something you buy without a prescription, something you think is completely harmless. But what I see every single week in my practice tells me something very different, and I think you deserve to know it. And in today's video, I'm going to walk you through 5 over-the-counter drugs that may be quietly working against your prescription medications. Number 1 on this list is the one I see most often, and it's probably sitting in your medicine cabinet right now. Stay with me. Before I give you the list, I want to explain something that most people don't realize about how the body changes after 60. Your kidneys and liver, the 2 organs responsible for processing every medication you take, they work more slowly than they did 20 years ago. That means medications stay in your system longer. They build up differently. And when 2 medications interact, the effect can be much stronger than either one alone. This is not a flaw. It's just how biology works. But it's something your pharmacist needs to know about, and often doesn't have time to explain. That's exactly why I make these videos, because the conversation that should happen at the counter rarely does. And that gap can be costly. Let me walk you through an illustrative scenario. Let's call him Robert, 71 years old, retired engineer, sharp as ever, manages his own medications carefully. Robert takes a blood pressure medication, a cholesterol medication, and a low-dose aspirin pine, all prescribed by his cardiologist. What nobody asked Robert, not his doctor, not his previous pharmacist, was what he was taking on top of those prescriptions. That question matters. Number 5, and this one surprises almost everyone the first time they hear it. We're talking about antacids, the ones for heartburn and indigestion. Millions of seniors take antacids every day. Tums, Rolaids, Melanta, Malet. And there's nothing wrong with that. The problem is the timing. Antacids that contain calcium, magnesium, or aluminum can bind to certain medications in your stomach before those medications have a chance to be absorbed into your bloodstream. What that means in practice? The medication goes through you without doing its job. Your body never actually receives the full dose your doctor prescribed. The medications most affected by this include certain antibiotics, thyroid medications like levothyroxine, and some In Robert's case, he was taking an antacid every morning 10, right before his thyroid medication. He had no idea they were interfering with each other. The fix here is simple. Space them out. Most pharmacists recommend at least 2 hours between an antacid and any of these sensitive medications. Talk to your pharmacist about the specific timing that works for your medications. That one conversation can make a real difference in how well they work. Number 4. This is one I talk about constantly in my practice, especially with patients who struggle with sleep or seasonal allergies. Over-the-counter antihistamines, the ones in most allergy medications and many sleep aids. Very common in seniors over 60. The active ingredient in most of these is something called diphenhydramine. And diphenhydramine has a sedating effect. That's actually why people take it for sleep. The problem comes when it's combined with prescription medications that also have a calming or sedating effect, like anxiety medication. When 2 sedating substances meet in the body after 60, the effect isn't just additive. Because of how the aging liver processes these compounds, what that looks like in real life? Unusual drowsiness, confusion, difficulty with balance, and a significantly elevated risk. There's also something called anticholinergic burden, the cumulative effect of several medications that affect a brain chemical called acetylcholine. Diphenhydramine carries a high load. If you use a sleep aid or allergy medication regularly, and you're also on a prescription sedative of any kind, please discuss this combination with your pharmacist. Number 3. This is the one that comes up most in conversations with patients managing blood pressure, and it catches people off guard every time. We're talking about over-the-counter anti-inflammatory pain relievers, ibuprofen, naproxen, the medications in Advil. Here's what the research in geriatric pharmacology consistently suggests. These medications may work against your blood pressure medication in ways that are completely silent. NSAIDs, that's the class these belong to, cause your kidneys to retain sodium, and retained sodium means retained water, and retained water means higher blood pressure. So if you're taking a medication specifically to bring your blood pressure down, an NSAID may be partially undoing that work every time you take it. There's a second layer here. NSAIDs also reduce the effectiveness of diuretics, the water pills that many seniors take for their heart or blood pressure. This is a combination I see regularly in my practice. Someone's numbers aren't responding the way they should. And nobody has thought to ask about Advil. Robert had been taking ibuprofen for knee pain 3 times a week, sometimes more. His cardiologist kept adjusting his blood pressure medication. The numbers stayed high. When we finally had the conversation at the counter toe, and I asked him about his pain routine tastes, we found the missing piece. It had been there all along. We still have 2 more on this list to tam, and I want you to hear them before you go, because numbers 2 and 1 are the ones most seniors miss. Number 2 involves something that millions of seniors add to their routine without telling their doctor. And number 1 isn't a single drug, it's a pattern. A pattern I see in roughly 1 out of every 3 patients who comes to my counter with a full medication list. And most of them have no idea it's happening. Stick with me through the next few minutes. What I'm about to share could genuinely change how you manage your medications. Number 2, and I want to frame this one carefully, Kat, because it involves a medication that most seniors consider completely routine, almost protective. We're talking about aspirin, not the low-dose aspirin your cardiologist may have prescribed. I'm talking about regular-strength aspirin. Many seniors are already on a prescribed low-dose aspirin, 81 milligrams per day ALF, as part of a heart or stroke prevention protocol from their doctor. When they add a full-strength aspirin, 325 milligrams cures, on top of that, the antiplatelet doesn't simply double. And if that same person is also on a blood thinner, warfarin, apixaban, or rivaroxaban, you now have 3 substances. The concern here is bleeding. Internal bleeding that can begin silently, here without obvious symptoms, before it becomes serious. I'm not saying aspirin is dangerous on its own. For many people, it's prescribed for good reason. What I'm saying is, the combination matters. Robert had a low-dose aspirin on his prescription list. What he hadn't mentioned was that he was also taking full-strength aspirin for a recurring shoulder pain. When I ran through his full medication list at the counter, including the over-the-counter items Pooks, we caught it. That conversation took 4 minutes. 4 minutes that changed his medication plan. Not because his doctor made an error cod, but because no one had ever asked the right questions at the same time. And now number 1. This is the one I've been building toward. And it's different from everything else on this list. Number 1 isn't a specific medication. It's the pattern that happens when nobody has a complete picture of everything you're taking. In geriatric pharmacology, we have a name for it, polypharmacy, managing 5 or more medications simultaneously. And here's what the research consistently shows. The more medications someone takes, the higher the likelihood that at least one interaction is going undetected. Not because doctors are careless, they're not, but because each specialist sees one part of the picture. The person who is most likely to see the full picture is your pharmacist. If you show them everything. Robert had 4 different prescribers over the years. None of them had a current list of everything he was taking, including the things he bought without a prescription. When we sat down together at the counter and went through everything, of every bottle, every supplement, every OTC he used regularly, we found 3 interactions worth flagging. 3 interactions in a man who considered himself careful, informed, and on top of his health. He just had incomplete information. That's the gap I'm here to close. The most dangerous over-the-counter drug interaction isn't any single medication. It's the invisible space between all the medications you're taking where no one is looking. So Breg, what do you actually do with this information? I want to give you something concrete you can use before you leave this video. First, the next time you go to pick up a prescription, bring everything. Not just the prescription bottles. Bring the over-the-counter medications too. The sleep aids, the pain relievers, the vitamins and supplements, every bottle. Put them in a bag and bring them to the counter. This is called a brown bag review. Most pharmacists will go through the full list with you and flag anything that needs attention. This service is often available at no cost. It takes less than 15 minutes. Second, ask one specific question. Is there anything on this list that may be working against anything else I'm taking? That question. Third, if your primary care doctor doesn't have a current list of your over-the-counter medications, bring that list to your next appointment. Write it out before you go. These aren't complicated steps, but they are the steps that most people your age never take because no one ever told them they were necessary. Now you know. Robert came back to my counter 3 weeks after that conversation. He said his blood pressure had stabilized for the first time in over a year. His doctor hadn't changed the prescription. What changed was the information his doctor had to work with because Robert finally had the full picture to share. That's what this knowledge does. It doesn't replace your doctor or your pharmacist. It makes every conversation you have with them more specific, more useful, more complete. You now know something most people your age don't. And that knowledge gives you the power to ask better questions, starting with your very next appointment. If this video gave you something useful, share it with someone you care about, your husband, your sister, your neighbor who's managing a full medication list. They'll be glad you did.